The Siyayinqoba team went to Beggarsfort and met Lulu Ndlovu, who works with the Rural AIDS and Development Action Research. Let's see what they found out.
My name is Lulu Ndlovu, and I work here in the Rural AIDS and Development Action Research, that's RADA. We are part of VET's School of Public Health, and we've been working here working with women who are enrolled in the Microfinance Small Enterprise Foundation. We're trying to find out whether we can reduce the rate of HIV infection by giving women financial support, and would they be able to make their own choices in terms sexually in terms of using a condom. Women come together to repay their loans, and then after that we do the training, gender and HIV training. And since we started working with them, these women wouldn't talk about personal issues. They wouldn't talk about sex. They wouldn't mention condoms. And we had to go through a lot of hurdles to get them to open up.
And le se la dumelang gore monna a gane gore tla roba le ka condom. Gobane condom e tshireletsa AIDS. E tshireletsa malwetse a tletšego.
We thought if we could link HIV prevention to a program that's already trying to empower women socially and economically, then maybe we have a better chance of them being able to implement HIV prevention. So that's how the microfinance and the HIV side came together.
Banna ba gana ka ba re condom a iswana le nama ka nama. Ba ra iswana. Ka matla ntwa tša ka malapeng mo go mo trikopo. Ti ka mo go ba banyetšwego. Ka gore monna o re ke go nyetše, o tlo mpha direkere mo a ke ditso.
Ke tlo go botša gore na wena ka wena o kile wa ka wa ba mathateng a go ba ntwa tša ka malapeng di diragale mo go wena. Okay.
Ba nyarša mo TV ka mo ka kgetha go salwe. Sela go fetola banna ba gore ba tle ba dumele condom. Ke go gona gore re se kra ba lema gore re ba fa ka mgo bona ba tsoma gona makana ke mo tlo go ba gona gore ka moka ba tle ba dumele condom.
Pero ba ka botloga bo fetogile auslulu gore ke joinile sefo ke go no tsibisha bana ba ka gore go na le kokwana tlhoko e tlileng ka moya e bitswang AIDS gore bolwetse bo tsena byang jole lena la tkhona o tshireletsa lena ke tloga ke lemogile gore ke a tkhona ke le motho go safara wa go hlaka be ke na le monna ka sala antshi a ntlogela le bana ba 5 topile mlikanyenyana wa ka ino ba boyfriend ga e tla ke moka ke topela di condom tse pedi tse tharo o thomile a gana before re sa di tsibi tse di condom ya re gona jalo self impile matla I've got the power.
And because of the training and because of the confidence they've been getting, older women who've never talked about sex now, kind of shocking these young people as they overhear their conversations in the taxi. They'll sort of jump in and start asking them about HIV. Are you using a condom? That sort of thing.
They're more vibrant. They're talking more. They want to be heard because they have money now and they have information.
In 1997, I was raped on my way to work. And I didn't know that time. I wasn't even sure that I was raped. It took me some time to understand it. And I went for the test after like 3 weeks. And then they called me and they told me I tested HIV positive. I went to the police station. I never went to any hospital because I felt so bad about being raped. I really felt so dirty. And the way I was treated in the police station made me feel filthy.
HIV has changed the landscape of rape from being an horrendous experience to what is really, even if you're not killed, you could acquire a disease that's going to kill you.
This is where I was in 1997 when I was raped. Ndafika ngizoreport icase ne ndahlala phe esitulweni and then ndabuzwa lipolisa pha ufuna ntoni sisi ndingakunceda ngantoni ndisoyika ukuthi ndirechiwe it's another rape case again, and that was the response in 1997. But now, what's happening now, I always take people to the same police station, the rape victims, and then now you just tell them, sorry, it's private, I can't talk in front of people, and then they take you to these rooms inside here. So at least you're more comfortable here. You report everything. They take you to the social workers of Gugulethu from rape crisis. They take you straight to Tutuzela project where you got the access of the rape post-exposure prophylaxis where you can prevent the infection of HIV. So people must report the rape cases to police station. It's never like before. Everything is different now. You can prevent infection. You can survive.
If you are physically okay, probably the best thing to do is to go to the police station. However, if you're right next to a health facility, go to the health facility first, because it is absolutely in order and in policy for the health facility to call the police to come and see you at that health facility rather than you having to go to the police. So whatever is closest.
From the police station, Gugulethu police station, they take you to GF Josta Hospital where they've got Tutuzela project. And in this project, they help rape victims. They give them proper counseling, and they've got access to the antiretrovirals to prevent the HIV/AIDS infection. Unfortunately, I was never here because it was never here at that time.
Oh,
okay, you're right.
Okay, njengoba usubona ke apha abantu bethu bafikela apha uzofika ne-ambulance man and then ke sign lo form yabo and welcome our patient, and then ke ngoku siye naye pha kula room yethu apho si counselisha khona.
Oh,
sihlala apha ke singokole ngingxaki yakho apha sibona uba bekwenzeke ntoni nini noba uyiwadlule police station okanye uze apha straight.
The experience of rape has been psychologically likened to a near-death experience, where the inner scaffolding of a person's being is just shattered. And the response to that for many women is to go into denial and try and make as if everything's okay. You know, it's like to quickly rebuild your house that's been bashed down. And now you've got to take drugs, and every time you're taking a drug, it's reminding you that you've just been raped. And that it breaks through denial, makes the denial harder, if that's your psychological response. So we've actually, we suspect, and some studies have shown, that the compliance with post-rape medication is very poor. And that's possibly one of the reasons. Plus, of course, all the side effects.
It is my right to have the medication. It is my right to get the treatment. It is my right to save myself from what I don't want to get. Forget about side effects, because when you're raped, you don't even think about side effects. You just want to get the medication because side effects are better than having HIV.